Welcome to Open Dental's Ortho Setup webinar. Open Dental has some orthodontic features that can help with the management of orthodontic patients, clinical charting, and claims. In this webinar, we will be covering the setup options for the ortho features in Open Dental. From the main menu, we'll go to Setup, Preferences, and Ortho. In previous versions of Open Dental, this can be found under Setup and Ortho. From this window, we can set all default orthodontic preferences for display options, claims, the ortho chart, and ortho case setup. Starting from the top, we have Show Ortho button and tab in Chart module. This adds the Ortho Chart button and an Ortho tab to the Chart module as an alternate method of keeping track of visits. Show Auto Ortho in Account module. This adds an Auto Ortho tab to the Account module and an Ortho tab in the Edit Insurance Plan window. In the Account module, this would include the insurance ortho claim defaults, as well as the patient's ortho treatment details, such as total months, months in treatment, and time remaining. In the Edit Insurance Plan window, you can set how frequently a patient shows up on the Ortho Auto Claims report to easily bill periodic claims to insurance. Show Auto Ortho information in the Ortho chart. This includes the Auto Ortho information in the upper right corner of the Ortho chart window. Mark claims as ortho if they have ortho procedures. If a claim has any ortho procedures on it, the claim or pre-auth will automatically have the Is Ortho checkbox marked. Use the first ortho procedure date as date of placement. This will automatically use the first completed ortho procedure as the banding date. This date would show as the start date in the Auto Ortho tab and in the Edit Claim window. Completing debond procedure overrides months treatment. When a debond procedure is set complete, the treatment months total is updated. Months in treatment and months remaining will also stop calculating. Default months treatment. This is set in months, not years. As this can be set on a case-by-case basis, the number entered here would be what's typical for your office. Show Ortho Chart in Appointment Options. This allows you to right-click on an appointment and open the Ortho Chart without leaving the appointment module. Patient Clone. This turns on the Clones feature, which makes the Clones button visible in the Family module. Adding a clone creates a duplicate of a patient to separate account ledgers and charts by specialty at your practice. The cloned patient's name will be in all caps. And some demographic information and the insurance plan information will be brought over as well. For more information on how clones might be useful for your multi-specialty practice, see the link in the description below. Default Ortho Auto Proc. This is the default procedure used on claims created using the Ortho Auto Claims tool for carriers that would like a periodic claim during the course of treatment. I'm using this code I created, but you can use whichever code you'd like as long as it's not one of the ortho placement procedure codes in the box below. Whichever code you use, we recommend using a $0 code. Of note, the .auto at the end is strictly for in-office tracking, as Open Dental only sends the first 5 characters of a procedure code on a claim. On the account, the .auto makes it easy to see at a glance that the Ortho Auto Claims tool generated this claim. Consolidate ortho insurance payments. For periodic claims created using the Ortho Auto Claims tool, this setting requires all ortho insurance payments to be posted on the original ortho claim. If this is turned on and you try to post a payment to one of these periodic claims, you will get a pop-up stating this preference has been checked, and it will offer to open the original claim now. This allows you to post a supplemental payment. Ortho Chart Display Fields. This is a shortcut for the setup of your ortho chart, where you can define tabs and fields that will show in the ortho chart. More details will be discussed in the Ortho Chart webinar. Ortho Hardware Specs. This is a shortcut to the setup of your ortho hardware spec list, where you can set the type, description, and colors for brackets, wires, and elastics used in your practice. Items created here can be chosen as options in the Ortho tab in the chart module. Ortho prescriptions. Here you can create a list of favorites to add hardware to multiple teeth at once. If you have a standard hardware setup you like to use, you can create a prescription for that. Ortho hardware specs must be set up prior to creating ortho prescriptions. Ortho placement procedures. Current procedures to consider for the patient's date placement. This defines which procedures will be considered as the initial ortho procedure to use as the date of placement in the auto ortho information. This is an override to the Use First Ortho Procedure Date as date of placement preference above. If you are using auto ortho, there must be codes entered here. If nothing is entered here, Open Dental will attempt to use the first code within the span of D8000 through D8999 as the initial ortho procedure. You can add and delete codes from this list as needed. Ortho case procedures. Here you can define procedures to use for the ortho case feature. This will show the Ortho Cases tab in the Account module. This feature is helpful if you pay your ortho providers on production over time instead of charging the full ortho production upfront. This feature can be used to determine the schedule of ortho treatment charges over time, even if the case is a transfer from another office. Turn on logging. Unless you are instructed to do so by one of our technicians for troubleshooting, there is no need to have this box checked. This concludes our webinar for the Ortho Setup. Thank you.
Thank you for joining us for today's webinar. If you have additional questions, please call our support line at 503-363-5432. And to make sure you're staying up to date on our latest training videos, don't forget to subscribe to our channel and turn on notifications.